Christian Barker, a physical therapist student at Advent Health University, and today I will be performing the compression test. So this test is to assess if the patient has a high ankle sprain. So what I'm going to go ahead and do, I'm going to apply compression on the distal third of the tibia and fibula. And I'm going to go ahead and do a good compression right there. I want to be away from the malleolus. And a positive test would be a reproduction of patient's symptoms, and I would do that to the unaffected and then the affected leg first. Today I will be performing the cotton/clunk test, which is another test for testing high ankle sprain. So what I'm going to go ahead and do is I'm going to stabilize the tib fib, and then I'm going to apply a lateral force on the talus. So we're going to go ahead and just like that. And so a positive would be reproduction of patient symptoms, or if there are lax, you can hear a clunk. The other test is the medial subtalar glide, which we're going to change the position of our hand. We're going to go ahead and stabilize the tib fib again, and I'm going to apply a medial glide on the talus. And so a positive again would be reproduction of patient symptoms, or if they're lax, we'll also hear the clunk. Today we will be doing the Kliger external rotation test. So what I'm going to go ahead and do is stabilize the tibia. I'm going to grab the calcaneus and I'm going to externally rotate the foot and you'll feel a separation of the mortise. And a positive would be a reproduction of symptoms, and this is a good test to isolate high ankle sprain from the lateral ankle sprain. Another test for high ankle sprain is the fibular translation test. So what I'm going to go ahead and do is find the malleolus, and I'm going to go proximal to that, and I'm going to find the fibula. And what I'm going to do is I'm going to get down in line of the force, and I'm going to apply a posterior force to that. And so I'm looking for reproduction of patient symptoms, and I can also go ahead and apply an anterior force in the line, and we're also looking for reproduction of patient symptoms. So another special test that we will be doing is the heel thumb test, which is another special test for high ankle sprain. And so what I'm going to do is I'm going to stabilize at the tib fib, and I'm just going to apply a thumb to the calcaneus. And a positive sign would be a reproduction of symptoms. So today I will be doing another special test for a lateral ankle sprain. It's called the anterior draw test. And this test can isolate the ATFL. I would also do the uninvolved and compared to the involved, because some people have natural lax in their joint. So I would go ahead and stabilize the tib fib and go ahead and grasp around the calcaneus and apply an anterior translation. And so a positive would be excessive translation or a clunk. Another special test for lateral ankle sprain is the Taylor toe test. So I'm going to go ahead and I'm going to find the calcaneus, and I'm going to go close to the malleolus, and then I'm also going to find the talus and come off of that. And so what we're going to do is we're going to do slight inversion, and we're going to be looking for excessive gapping or reproduction of patient's pain. This can also have a clunk sound, and it can also indicate the ATFL and the CFL. So today we will be assessing to see if there's any vascular issues. And so the test that I will be doing today is the Holman test. And pretty much what I'm going to do is I'm going to palpate the patient calf to see if I reproduce the patient deep calf pain. Since this test is not very specific, I can sensitize by putting the foot into dorsiflexion and reproducing and redoing the squeezing of the calf to see if I get that deep calf pain again. We can also use other signs like palpation at the dorsus pedialis poles, palpation of the popliteus poles, and also skin discoloration to assist if there's any like vascular issues like DVT. Another vascular assessment test is the Burgers test. So pretty much what we're gonna do is I'm gonna elevate the patient's leg and I'm gonna hold it for 3 minutes. I'm gonna assess the leg. We're gonna look for blanching or collapse of the vein. And so we would hold this for 3 minutes. And so if we see blanching or collapse of the vein, we can say that this is a positive test. After the 3 minutes, we will go ahead and we will lower the leg and we will lower it all the way down. And then we will observe to see how fast the veins fill back. If it takes more than 30 seconds to fill back, we can say that it's also a positive test. Another special test is the Thompson test, which could use to assess if there's an Achilles rupture. So what I'm gonna go ahead and do is I'm gonna go ahead and squeeze the belly of the gastroc and the soleus and observe what is happening at the foot. Right now the foot is plantar flexing, and so a positive test would be no motion, and that would indicate that there is a rupture. The kinematics for this test is really weak, so if the patient had a partial rupture, it might come back as negative. That we can do in suspicion of an Achilles rupture is called the Matlis test. So I'm gonna go ahead and have my patient, can you go ahead and bend your knee really slow for me? Slowly, good. And so while the patient is bending their knees, I'm observing the angle of the foot and the ankle. And if I see a drop or a lax, that would be a positive test, but it is a negative test if the foot stays in neutral. Another special test for Achilles tendinopathy is called the Royal London Hospital test. And so pretty much what I'm gonna do is I'm gonna squeeze in the area where I believe the insertion of the tendinopathy is. I'm gonna go ahead and squeeze until I reproduce the patient's symptoms. Then I'm gonna release it, and I'm gonna have you go ahead and maximally dorsiflex to bring your feet all the way in. And then I'm gonna go ahead again and apply the same amount of tension that I previously did that reproduced your symptoms. And so a positive would be decrease of symptoms after the maximum dorsiflex, and that would indicate Achilles tendinopathy. Another neurological test that could be performed is the Tinel test. The Tinel test could be performed in 2 different locations. We could perform it on the talar crural joint, where the anterior deep fibular nerves run, and we'll go ahead and we kind of just we tap. And then a positive would be a positive reproduction of numbness or tingling or stinging sensation. The other one where we could test is by the lateral malleolus, and we will go posterior to that, where the tarsal tunnel runs, where the tibial nerve runs in there. And so we will also go ahead and find the malleolus, and then you go posterior to that. And when we tap it, a positive would be reproduction of numbness or tingling or stinging sensation. Another neurological test that could be used is called the Morton test. The Morton test tests for Morton neuroma, which is an overgrowth of nerve bundles, which are usually between the 2nd and 3rd metatarsal and the 3rd and 4th metatarsal. So how we do this test is we go ahead and we compress the metatarsal, and then we look for reproduction of symptoms of numbness and tingling or burning sensation. Reproduction of symptoms. So today I will be observing the alignment of the navicular, and so what I'm going to go ahead and do is put a dot on the medial malleolus and also on the plantar aspect of the MTP joint. And so I'm going to go ahead and kind of draw that like imaginary line. Then I'm going to have my patient fully weight bear, like step down. So if the navicular falls below the invisible line, that would mean the patient has a low arch. And if the navicular is above the line, that would mean the patient has a high arch. I'll be performing the functional hallux limitus test, which tests the mobility of the first ray and the hallux MTP. So what I will do is I will put the foot into subtalar neutral. And then what I will do is I will extend the big toe, and while I'm doing that, I'm looking to see if the first ray has to excessively plantar flex to get that extension of the first ray, and a positive test would be excessive plantar flexion of the first ray. The next test I will perform is the windlass test, and so this test is to assess if a patient might have plantar fasciitis. We're going to go ahead and have the patient step on top of the stool, and what I'm going to do is go ahead and extend their big toe. And a positive would be reproduction of pain or pain at the insertion of the plantar fascia.